manage your pregnancy. They have to watch all the time any symptom you have to avoid that something happened to you and to your baby.
Lupus patients who become pregnant should be considered high risk and followed closely by their obstetricians. Lupus patients who are considering pregnancy should consult with their physician for preconception counseling. Once the diagnosis of lupus is made, patients may become very concerned about the ramifications of this disease. Lupus was once considered a fatal disease, but this changed dramatically in recent years. Here are the facts. Life with lupus will mean changes to your lifestyle, but with early diagnosis, consistent treatment, and a good working relationship with a physician, 80 to 90% of patients can expect to live a normal lifespan. That is not to minimize the fact that many will struggle with the debilitating effects of the disease every day of their life. In the majority of lupus patients, a long-delayed diagnosis, side effects from medications, and ongoing emotional issues may be some of the biggest challenges. It may also be very difficult for many lupus patients to remain well enough to be employed full-time.
As for work in general, I actually had to quit my job and take roughly a year off because I couldn't function properly.
Deaths from lupus are usually due to organ failure or infections, sometimes from a weakened immune system induced by the disease or by chemotherapy. But 80 to 90% of patients can expect to live a normal lifespan.
I had real questions about the length of time, how much time I had in the world. And as I said, many of the books that I read obviously gave the wrong information.
I can remember when I had one of my rare male patients with lupus that his wife read one of those things and said, lupus is a disease of women and death comes within 5 years. And I said, well, first of all, you know that your husband isn't a woman, and second of all, that's a pack of lies. And a lot of the stuff that's out there is really pernicious in that way. Lupus is a serious illness. It requires collaboration with your physician. It requires treatment. But the longer you've been with it, the better off you're going to be. The statistics show that if you had a diagnosis for 2 years, why your life expectancy is the same as everybody else. You're going to have some problems, but your life expectancy is good.
Once you've been diagnosed with lupus, it's important not to overreact. There are many common sense approaches and techniques that one can use to improve the quality of their life. It is wise to expect emotional ups and downs that often accompany chronic illness. It is normal to feel a variety of feelings.
I get sad because I start blaming lupus for things that I feel like I can't do.
It was a time when I was really depressed.
I had doubts about, how long will I live? What are my next steps, for my life?
The best way in learning to deal with emotions is to enter your feelings in a journal, confide in a good friend, attend a support group, or address these concerns with a therapist. Don't lose hope. Keep a sense of humor and try to stay positive. Probably one of the most important things you can do is have open communications with your physician. You'll need to have regular office visits and lab tests and keep track of your symptoms or drug side effects so that your doctor can stay informed. Be well prepared for each office visit by taking a written record of these facts and questions you may have and a complete record of the medicines you take and dosages. Trust your intuition and be sure you're being heard. Be very cautious with sun exposure. Many lupus patients are sun sensitive. If so, wear sunscreen, protective clothing, and seek out the shade. Consult with a dermatologist for skin lesions and check into concealing makeup if lesions are visible and prominent. It is very important to manage your stress level to avoid flares. This can be done by exercising, practicing meditation, limiting caffeine, taking a walk, reading, or any other activity that helps you feel relaxed. You must make time for this every day. Watching your diet, good grooming habits, and exercising will help you look and feel more attractive and help you maintain a positive outlook.
I've just learned to relax a lot more. I've taken up gardening. I've also started painting terracotta pots. It's my form of meditation.
With my lupus, I really had to look at other avenues of recreation. Photography has been one of my passions. I've won a couple awards, Best of Show for the Santa Cruz County Fair. It really promoted me to go out and do a little bit more and try and get to that next level and be beyond my sickness.
I love to read books. I love reading. I go to the doctor's office and I'm just going through the magazines, or if I don't have my book with me.
Be realistic about what you can and cannot do. Avoid becoming exhausted. Don't be afraid to say no when you need to do so. Do the things you enjoy, the things that make you feel good. Become informed with accurate medical information about lupus. The Lupus Foundation of Northern California has a wealth of educational materials and programs beneficial to lupus families wherever they may live.
I had many physical problems that led to 20 hospitalizations, and the physicians that were following me didn't have a clue as to what was wrong with me. A rheumatologist diagnosed me as having lupus. I went on my own search for information about lupus, and through this search, it drew me to the conclusion how important it was to form an organization that could provide up-to-date factual information about lupus that offered encouragement for those that suffered from lupus and their families.
The Lupus Foundation has helped me a lot as far as getting in touch with other people who have lupus. I find that their support group has been really great for me.
The Lupus Foundation of Northern California actually was really beneficial. The Lupus Foundation has actually provided many great resources.
They know what I'm talking about, and there's a vast source of energy in the support group by itself. You know, we talk about our doctors or how we approached a problem, so we're sharing our life experiences and the ways that we cope with lupus. It's very enriching.
The more knowledge you have about the disease, the more you'll be able to help yourself live a more productive, fulfilling life. Lupus is still a mysterious disease, but through continued research, new discoveries are unraveling those mysteries each year. You can live with lupus. Learn the facts and know that the Lupus Foundation of Northern California will be there to help you every step of the way.
The older you get with lupus, the better you're going to be, and the more likely you are to survive longer. So think of yourself as a bottle of good wine that's improving with age.
When I was first diagnosed with lupus, I saw my life as being short-term. Now it's 10 years since my diagnosis, and here I am. I'm very fit. I'm doing well. I actually have control of my life.
At times, I do feel lucky for having lupus because I had to learn a lot of things early on.
You know, you could really deal with it and learn to live with it as long as you make some significant changes. It doesn't mean ending things that you love to do, but just tweaking them a little so that you can still do them and be happy.
Life has been good.